Welcome to Department of Anatomy, Faculty of Medical Sciences, University of Sri Jagadhpur. In this dissection series, we will try to orientate and understand a cross section at the lower forearm. First, we will try to orientate this specimen. You can clearly see there are two bones, and there are some structures, much more bulkier structures at this part of the specimen, and less bulkier structures at this particular part of your specimen. As you all know in your theory, the flexor compartment is much more bulkier than the extensor compartment. So this is the anterior aspect of your specimen, and this is the posterior aspect of your specimen. In the lower forearm, the radius is much more bigger compared to the ulna. So this is the radius and this is the ulna. Since this is the radius, this is the radial artery. Since this is the ulna, this is the ulnar artery and this is the ulnar nerve. Now, first we will try to orientate the structures at the anterior compartment of your forearm. In the anterior compartment, you can clearly see there are some tendons here. These are the flexor digitorum profundus tendons. This particular tendon is the flexor digitorum profundus tendon for the index finger. Here you can clearly see the median nerve. This particular tendon is the flexor pollicis longus tendon. This particular tendon is the flexor carpi radialis tendon. These are the flexor digitorum superficialis tendons. This particular tendon is the flexor carpi ulnaris tendon. Now we will try to come for the rest of the part of the specimen. In between the ulna and the radius, you can see a transverse muscle. This is the pronator quadratus muscle. In the posterior aspect, you will find the ulna, and behind the ulna, you can see the extensor carpi ulnaris tendon. Then here you can clearly see the extensor indicis tendon and the extensor digitorum tendons. Then this particular tendon is the extensor pollicis longus tendon. Here you can clearly see the extensor carpi radialis brevis and the extensor carpi radialis longus. Since this is the radius, you can clearly see the brachioradialis will come and insert at this particular region. Outside that, you can clearly see the abductor pollicis longus tendon and the extensor pollicis brevis tendon. So this is how you will orientate and understand the cross section of the forearm at the lower segment above the wrist joint. Thank you.